My journey with Ehlers-Danlos started several years ago. In my work as a specialist in nerve and muscle conditions, I was also seeing a lot of patients with autonomic disorders and a particular disorder called POTS, or postural orthostatic tachycardia syndrome. That's something that happens very often in people with Ehlers-Danlos syndrome, and I diagnosed a woman as having that, and she set up a support group, and then she started sending patients to me. And then I started seeing more and more patients with Ehlers-Danlos syndrome, and I learned more about it, read about it, got proficient in seeing these patients. And 3 years later now I've taken care of hundreds of these patients, and it's become a very big and important part of our practice, and something that I take great pride in. Ehlers-Danlos syndrome is a disease that was thought to be very rare, but is actually quite common. And unfortunately, what happens is that most of these, or many of these patients, either aren't diagnosed or are diagnosed with other conditions, or worst of all, are told that there's nothing wrong with them and that they're sort of anxious or neurotic or just sort of overly focused on symptoms that don't really have a cause or aren't important. And nothing could be further from the truth. Many patients with Ehlers-Danlos syndrome are quite limited and disabled and bothered by a great number of symptoms. So again, we're very happy to have a center where we can provide expert diagnosis and expert care, partnering with other providers that can help affect great changes in their lives, such as physical therapists and other physicians like allergists and gastroenterologists and orthopedists and cardiologists. If you'd like to learn more about our center or how to become a patient, you can fill out information on our website or email us or call us. A member of our team will get back to you promptly.